Any other questions or observations about post GYN or birth?
Not
issues?
specifically about childbirth, but I do have to kind of switch gears, if you don't mind. I wanted to get your thoughts on, when you guys were talking to Dr. Kessel and you guys brought up the average age of menopause, which was 51 or 52, correct?
Correct.
And then he said that in terms of perimenopause, right, hormone levels can be all over the place.
All over.
Okay, so it's pretty widely accepted and known, right, that women, people who get tight shoulders or frozen shoulders just out of the blue, typically are women in their perimenopause, menopause years, right? So whenever you try to do like a little search and find out the reason why, I've never found a specific reason why. So I don't know if when, it's estrogen levels that drop, right? What is the correlation? Do you have any thoughts on why that's
So I think, again, it's probably multifactorial. So not just one thing, and everything's kind of going a little nutty. But we did find some studies that showed like estrogen helps regulate collagen turnover and joint elasticity, maybe.
That's interesting.
So maybe that's why. And just with low estrogen and menopause in the age, you have increased like fibrosis and reduced capsule elasticity. I'm not sure. And then also your inflammatory responses are different, I think, during that whole peri and menopausal kind of time. So I don't know. They think that menopause actually puts you, and I'm not sure about this, in a very low inflammatory state.
A low inflammatory state?
That's what they say. Menopause is associated with a low-grade inflammatory state. And so it's just
but higher
metabolically.
Than baseline?
I don't know. These are just all like,
Sure, theories or thoughts. Yeah.
and thoughts about why this might happen.
Your other question you asked about is frozen shoulder more common after menopause, and it is associated with it.
Yeah, because...
But I don't think they have one reason.
Yeah, but for some
necessarily
reason...
why.
And it might be just an age thing too, right?
Yeah, because I tell you, like, right now, probably 90% of my day is seeing shoulder patients.
Really? That many?
Yeah.
Wow.
And...
all menopausal age?
Lots. Right? It's the same thing, back in the day.
What is a frozen shoulder, though? Like what?
Is when your capsule gets tight or it's painful. So what happens is people start having shoulder pain.
Yeah.
And then it's from inflammation, right? And then because it's sore, they stop moving it.
Yeah.
So then...
but it's not like an arthritis necessarily.
It can be caused by arthritis or anything that causes some kind of inflammation in the joint.
But basically, it's inactivity that causes it to be frozen.
What happens is your response to it, right? People get sore shoulder.
Yeah.
Then they don't want to, that hurts, so they stop moving it. So pretty soon, it's going to get tighter and tighter because they stop moving it to the point where...
Like a stiff neck.
So actually, the treatment is stretching.
Oh.
You have to actually, stretch it. And anyway, we'll have Dr. Weldon on one day to talk about that because it's that's a super common interest top with a very, very simple but simple solution of stretching, but you got to be diligent.
Yeah.
Yeah. But
do you find it like most of them recover?
Most do.
Oh.
Sometimes it's harder than others. Occasionally, I know that I'll ask like Dr. Weldon what his thoughts are on, is this person a candidate for manipulation under anesthesia? And so sometimes
I think you're right, though. I think it just more has to do with kind of maybe age.
Well, this is saying that the peak incidence of frozen shoulder occurs around age 55, and this is in both men and women.
Both men and women. That's important.
That's both
but
men and women.
if I see a guy who's say his late 40s, 50s,
Yeah.
come in with a frozen shoulder for no reason at all, my first question is, do you have diabetes?
Oh.
And almost always they do.
Yeah.
Yeah, diabetes is definitely...
Yeah.
Yeah. But the mechanism, I'm not sure. I would have to look that up and see.
But when women are in their perimenopausal, menopausal years, it takes very little for some to push them over the edge to get a frozen shoulder. Like I've seen during the pandemic, say you get the vaccination, it kind of hurts your deltoid. Yeah, they don't move it, boom, frozen shoulder.
Really?
They
that
say,
quick?
Oh yeah, real quick. Or I'm working from home now. Frozen shoulder because they're not getting dressed, brushing their hair, opening doors, driving, right?
Yeah.
Decreased activity, boom, frozen shoulder.
So this here says statistically, patients with diabetes on a meta-analysis of 13 studies, almost 4 times more likely
Yeah.
to have
Says
frozen
shoulder is more common in people with diabetes.
Yeah.